All right, now to the growing outbreak of hepatitis A. It is definitely on the minds of a lot of people in our area. And here today to help parents and children stay healthy is Dr. Celina Moore from West Boca Medical Center. Doctor, good morning.
Good morning.
Boy, this thing
Afternoon.
afternoon, exactly. This thing has spread like crazy. We just heard that news conference for the better part of the last hour. How does hepatitis A spread?
Hepatitis A spreads by the colorful terminology of fecal or oral contamination.
Okay.
So it is spread through poop, unwashed hands, or not washed well enough, and then either through food, water, or direct transmission.
All right, so are there symptoms for, say, infants and younger children that maybe are different from some of those?
They are. Under the age of 6, they do not have the typical symptoms. And sometimes they can have what we call subclinical illnesses, that they don't have the full range of symptoms that might lead us to test them.
All right, so how do you protect your children, maybe who are attending daycare?
Fortunately, it is on the vaccine schedule at the age of 12 and 18 months. So children who've
For
been
hepatitis
for
A,
hepatitis
not just
A,
hepatitis B.
Correct. Hepatitis B begins at birth, hepatitis A at 1 year. So all children who are following the schedule will be vaccinated.
All right, infants throughout.
Well, yes, you can be vaccinated as low as 6 months,
Okay.
but it doesn't count towards the regular vaccine schedule. So if there is an outbreak and you're worried about 6 month and over child, you can get them vaccinated.
All right, so what is the first onset symptom that you would need to go to the hospital right away?
The big thing that you would notice that apart from like a regular stomach bug would be yellow tinge to the eyes and to the skin. So that's called jaundice.
All right.
But the first couple of weeks, while you're still transmitting the virus, you might not have any symptoms at all. And then you have bellyache, fever, joint pain, vomiting, diarrhea.
But the yellow around the eyes, that's a telltale sign.
Yes.
But there's so many things that mimic, the flu, a cold, this and
Yes.
that. So, I mean, how can you tell the difference? Would that be?
That would be the big difference
clue.
between anything else.
All
yes.
right. Okay, what about, parents? If it's been a while for us as adults to have gotten a vaccine, or if we're not sure when we did that, is it too late?
Well, the vaccine's only been around in the United States since 1995. Okay. So it wasn't part of the childhood vaccine schedule until like the mid-early 2000s. That was mandatory for everybody. So most adults aren't vaccinated unless they actually went out and asked to be vaccinated. High-risk people will be the homeless population, people from other countries usually should be vaccinated because in a lot of other countries, hepatitis A is what we call endemic. And then, a lot of people who work in the restaurant business have been looking to get themselves vaccinated as well.
Okay. Now, this isn't something we hear a lot about. I mean, this year, all of a sudden, we are.
Yes.
So, I mean,
But it's been there.
Yeah,
Yes.
it's been there.
Yep.
But, I mean, is it something that if people hear, okay, there's 19 cases in Martin County, 3 deaths, I mean, there's no need to press the panic button.
Not the panic button, but awareness.
Yeah.
Right? And because with the incubation period is about 2 weeks, you still don't know how many more are coming out.
Right,
Yeah.
right. Any other information that people should know, parents?
Wash your hands,
Okay.
make sure you get under the nails, and vaccinate.
Okay.
Yeah.
Good to know.